Hi friends, welcome to the channel The Nurse. Here we are discussing about OBG questions and answers which will be helpful for preparing RRB and upcoming NVS exams, NVS staff nurse exams. If you are not subscribed to our channel, please subscribe. We will move to the topic OBG MCQs along with the current affairs. So both RRB and NVS exam having current affairs questions. That is why I have included these current affairs topics. OBG MCQs 2024. A 30-year-old woman present with irregular periods and weight gain. What is the most likely diagnosis? PCOS, gonorrhea, thyroid disorder, hyperprolactinemia. Correct answer here, PCOS. So what is the full form of PCOS? Can you comment here below? So PCOS means polycystic ovarian syndrome. So we will go to the small explanation. Polycystic ovarian syndrome is characterized by irregular menstrual cycles, weight gain, and hyperandrogenism. Hyperandrogenism means it is most likely increased number of androgen hormones. Androgen hormones include mainly testosterone. So PCOS characterized by irregular menstrual cycle, weight gain, and hyperandrogenism. Next question. Which of the following is a common cause of infertility? Tubal blockage, ovulation disorders, endometriosis, all of the above. Correct answers. Most common cause of the infertility include tubal blockage, ovulation disorders, endometriosis. All three contributing infertility. Tubal blockage, ovulation disorder, and endometriosis are all common causes for causes of infertility. Third question. A 25-year-old woman present with stress urinary incontinence. What is the most appropriate treatment? Kegel exercises, bladder training, hormone replacement therapy, surgery. So correct answer is Kegel exercise. So for stress in urinary incontinence, Kegel exercise will be helpful. So Kegel exercises are first line treatment for stress urinary incontinence, helping to strengthen the pelvic floor muscles. So stress urinary incontinence usually happening because of the weakening of the pelvic floor muscles. So Kegel exercise will strengthen the pelvic floor muscles. Fourth question. Which of the following is a symptom of pelvic organ prolapse? Urinary frequency, pelvic pain, vaginal bleeding, vaginal bulge. Easy question. That is vaginal bulge. Vaginal bulge is the most common sign of pelvic organ prolapse. A vaginal bulge is a common symptom of pelvic organ prolapse where the pelvic organs protrude into the vagina. So vaginal bulging will be we can observe from outside. So according to the severity of the bulge, it is graded. So grade 1, grade 2, grade 3, grade 4. These are grading based on the severity of the bulging. Fifth question. A 28-year-old woman present with vulvovaginitis. What is the most appropriate treatment? Chemotherapy, antifungals, hormone replacement therapy, topical creams. So correct answer is antifungals. Usually vulvovaginitis is commonly caused by Candida albicans. So most common treatment for the vulvovaginitis is use of antifungals. Vulvovaginitis is often caused by fungal infections, making antifungals are the most appropriate treatment. One of the most common cause of vulvovaginitis is Candida albicans, that is candidiasis. It causes candidiasis. This Candida albicans can cause genital itching and thick white vaginal discharge with a cottage cheese-like texture. So that is the signs and symptoms of candidiasis. A genital itching will be there. A thick white vaginal discharge with a cottage cheese like texture will be there. Sixth question, which of the following is a complication of PID, pelvic inflammatory disease? Infertility, ectopic pregnancy, chronic pelvic pain, all of the above. So correct answer is all the three options are complications of pelvic inflammatory disease or PID. PID can lead to infertility, ectopic pregnancy and chronic pelvic pain due to scarring and damage to the reproductive organs. Seventh question, a 35-year-old woman present with heavy menstrual bleeding, what is the most likely diagnosis? Fibroids, endometriosis, adenomyosis, PCOS. Usually, heavy menstrual bleeding is associated with the fibroid uterus. In the case of endometriosis and PCOS, also there will be a bleeding, and it will be irregular in characteristics. And in the case of fibroid uterus, there will be a heavy menstrual bleeding. Fibroids are common cause of heavy menstrual bleeding, especially in women over 30s. Common symptoms of uteroid fibroids are bleeding between periods, heavy bleeding during your periods, sometimes with blood clots, periods that may last longer than normal, needing to urinate more often, pelvic cramping or pain with periods, feeling fullness or pressure in your lower belly, pain during intercourse. These are the common symptoms of uterine fibroids. So main symptoms are bleeding between periods, heavy bleeding during your periods, sometimes with blood clots, period that may be last longer than normal, needing to urinate more often. These are the common cause bleeding characteristics you can understand here. So next question, which of the following is a symptom of PCOS? Weight loss, regular periods, acne, hirsutism. So correct answer is hirsutism. In the first question, I have explained there that PCOS will cause hyperandrogenism. So hyperandrogenism means male hormone number will be increased there. So that will leads to hirsutism. Hirsutism means hair distribution. There is large amount of hair distribution throughout the body. Hirsutism, excessive hair growth, is a common symptom of PCOS due to hyperandrogenism. The symptoms of PCOS include missed periods, irregular periods, or very light periods, ovaries that are large or have many cysts, extra body hairs including chest, stomach, and back, that is called hirsutism, weight gain, especially around the belly. In the options, there is mentioned weight loss. Then acne or oily skin will be there. Then male pattern of baldness or thinning hair. So then finally infertility also will be there in the case of PCOS, polycystic ovarian syndrome. Next question, a 40-year-old woman present with pelvic pain and dyspareunia, what is the most likely diagnosis? Endometriosis, adenomyosis, fistula, PID. So pelvic pain and dyspareunia. Dyspareunia means pain during the sexual intercourse. So here correct answer is endometriosis. In endometriosis, the common symptoms are pelvic pain and dyspareunia. Endometriosis is a common cause of pelvic pain and dyspareunia, that is painful intercourse. The common symptoms is pain in the lower part of the belly, that is called pelvic pain. Pain may be most noticeable and it will be during a period, during or after sex, when urinating or defecating. So the characteristics of pain, that is it will be there during period or during or after sex, when urinating or defecating. 10th question, which of the following is a treatment option for pelvic organ prolapse? Surgery, hormone replacement therapy, Kegel exercises, all of the above. So in the case of pelvic organ prolapse, what option we can use as a treatment? Correct answer is all the above options, that is surgery, hormone replacement therapy and Kegel exercise we can use in the case of pelvic organs prolapse based on its severity. In very mild cases we can use a Kegel exercise. Then we will go to next step, hormone replacement therapy, that is mainly with oxytocin, and still it is persist in the severe pelvic organ prolapse, doctor will suggest surgery. Treatment options of pelvic organs prolapse include surgery, hormone replacement therapy with estrogen, and Kegel exercise depending upon the severity of the prolapse. So, pelvic organ prolapse is usually due to the muscle weakening, pelvic floor muscle weakening. What is next question? What is the primary cause of stress incontinence? Urinary tract infection, increased abdominal pressure, kidney stones, bladder cancer. So correct answer is increased abdominal pressure. So even usual increase of abdominal pressure during coughing or sneezing also will lead to stress incontinence. Stress incontinence occurs when increased abdominal pressure, such as from coughing, sneezing, or lifting heavy objects, causes urine leakage due to weakened pelvic floor muscles. So for a normal person, why it is not there? Because the pelvic floor muscle will be tight and strong. So in the case of weakened pelvic floor muscles, there is a chance of increased high intra-abdominal pressure during coughing, sneezing, or lifting heavy objects, causes urinary leakages. 12th question, which surgical procedure is commonly performed to treat severe stress incontinence? Appendectomy, sling procedures, hysterectomy, prostatectomy. Correct answer is sling procedures. Sling procedure is used to treat severe stress incontinence. The sling procedure is a common surgical treatment for severe stress incontinence, where a sling is placed around the urethra to provide support and prevent urine leakage. So in surgically, a sling will be inserted in the urethral opening, and it will prevent the leakage of urine. 13th question, what does the Montevideo unit or MVU measure during labor? Fetal heart rate, uterine relaxation, uterine contractility, cervical dilation. Correct answer is uterine contractility. Montevideo unit, that is the measurement of uterine contractility. The Montevideo units measures uterine contractility, specifically the intensity of uterine contraction during labor. We will discuss one more question, so you will get a more explanation there. A patient in labor has an Montevideo unit of 150. What does this indicate? Weak contraction, normal uterine contraction, strong uterine contraction, uterine hyperstimulation. So a score of Montevideo unit of 150 indicates it is a normal uterine contraction. So we will see what is a normal range of Montevideo units during labor, that is 100 to 200. So 150 comes under normal range. So it indicates normal uterine contractions. So this is Montevideo unit in the case of labor, but in other cases also Montevideo units are used, especially in urinary incontinence. So in that case, normal range will be different. So for labor process, the normal range is 100 to 200. Montevideo unit 100 to 200. That indicates normal uterine contraction. What is the primary mechanism of uterine involution after delivery? Contraction of uterine smooth muscles, relaxation of uterine smooth muscles, increased blood flow to the uterus, decreased estrogen levels. The primary mechanism of uterine involution after delivery, that is contraction of uterine smooth muscles. Contraction of uterine smooth muscle is the primary mechanism of uterine involution, which helps to reduce the size of the uterus after delivery. So involution means the uterus is going to its pre-pregnancy level. So uterine smooth muscle contraction helps to reduce its size. 16th question. What is the station of the fetal head when it is at the level of ischial spines? -2, 0, +2 or +4. Fetal head at the level of ischial spines. Correct answer is it is station 0. So I will explain how it is calculates. If the fetal head is at the level of ischial spine means that is the 0 station. If it is below 1 centimeter means the fetal head reaches below 1 centimeter of ischial spine means that is +1. That is -1, and if it is 2 centimeter below the ischial spine means that is -2 station, and 3 centimeter means that is -3 station. So it is assessed by using the finger breadth. So one finger breadth, it's usually it's count like 1 centimeter, or 2 centimeter below means 2 finger breadth will be there gap. If the fetal head is above 1 centimeter above the ischial spine means +1 station, or 2 centimeter above means +2 station. Like that it is measures. 0 station indicates that fetal head is at the level of ischial spine, which is the key landmark in assessing fetal descent during labor. So if based on that the progress of labor we will record. Then 17th question. Which stage of labor is characterized by the delivery of the placenta? Easy question, but it is repeatedly asking in every exams. So options are stage 1, stage 2, stage 3, stage 4. So correct answer is stage 3. So stage 1 labor, that indicates the regular uterine contraction, that is increasing in the intensity of the labor and progresses. Along with the complete, stage 1 ends with the complete dilation of cervix, that is 10 centimeter diameter. From there, the delivery of the baby till complete, from the complete dilation of cervix to delivery of the baby, that comes under stage 2. Then delivery of the placenta, that is comes under stage 3. So these are the 3 stages in labor. Stage 3 of labor is characterized by the delivery of the placenta. It is also known as after birth. So I think that is clear. What is the primary force behind the fetal descent during labor? Uterine contractions, fetal movement, maternal pushing, gravity. The primary force is uterine contractions, and maternal pushing and gravity also helps to descend the fetus during the labor, but the primary force is uterine contraction only. Uterine contractions are the primary force behind the fetal descent during the labor, although maternal pushing and gravity can also contribute. 19th question. Which of the following is a sign of labor progress? Increased cervical dilation, increased cervical effacement, fetal station, all of the above. So fetal station I already explained. So that is sure. So here correct answer is all of the above. So increased cervical dilation and cervical effacement, that also signs of progress of labor along with the fetal station. So according to fetal station, we can assess where is the fetal head or presenting part reached. All of the given options are signs of labor progress indicates that labor is advancing and delivery is nearing. Next question, what is the purpose of monitoring fetal station during labor? So it is easy question. So options are to assess fetal well-being, to determine fetal position, to evaluate labor progress, to predict labor duration. So correct answer is to evaluate labor progress. Monitoring fetal station helps to evaluate labor progress and assess whether labor is advancing or slowing. So here we will end the OBG questions. Next we will move to current affairs questions. So in current affairs, first question, which theory in international relations emphasizes the role of international institutions in promoting global cooperation? Realism, liberalism, constructivism, Marxism. Correct answer is liberalism. So liberalism in international relations theory emphasizes the importance of international institutions and cooperation among states to achieve peace and stability. So that is the role of liberalism in international relations. So we will move one more theory. The concept of balance of power is most closely associated with which international theory? Which international relations theory? Realism, liberalism, constructivism, feminism. The balance of power that explains in realism. So realism focuses on the idea that the international system is anarchic and that states must maintain a balance of power to ensure their survival. You can by heart these questions, so that's all. No need to go deep to know each and everything. So in nursing, you can directly by heart, and you can also go through questions like this. So that is why I am giving different topics here. Which international organization was established in 1945 to promote peace and cooperation among countries? NATO, European Union, United Nations, World Trade Organization. The correct answer is United Nations. United Nations was established in 1945 after the Second World War to promote international peace, security and cooperation among member states. Then 23rd question, the term soft power refers to military strength, economic sanctions, cultural influence and diplomacy, coercive tactics. The soft power refers to cultural influence and diplomacy. Soft power is the ability to influence others through cultural appeal, diplomacy and values rather than through coercion and military force. 24th question. What was the primary object of the India's Chandrayaan-3 mission? To explore Mars, to land on the moon's south pole, to study the sun, to orbit Jupiter. Correct answer is to land the moon's south pole. Chandrayaan-3 mission, that is to land moon's south pole. Chandrayaan-3 aimed to achieve a soft landing on the moon's south pole, making India the first country to do so. Which scientific discovery was made by Chandrayaan-3 on the moon's south pole? Presence of liquid water, ancient ocean of magma, evidence of life, active volcanoes. Correct answer is ancient ocean of magma. Chandrayaan-3 discovered remnants of ancient ocean of magma on the moon's south pole. So that was important discovery done by Chandrayaan-3. 26th question. What was India's projected GDP growth rate for the fiscal year of 2024-25? 5 to 6%, 6.5 to 7%, 7.5 to 8%, 8 to 9%. So India's projected GDP for the fiscal year of 2024-25, that is 6.5 to 7. So that was good project GDP growth. So compared to other nations, India's real GDP was projected to grow between 6.5 to 7% in the fiscal year of 2024-25. Next question. What was the retail inflation rate in India for the fiscal year 2023-24? 4.5%, 5.4%, 6.4%, 7.4%. Correct answer is 5.4%. The retail inflation rate in India declined to 5.4% in the fiscal year 2023-24. So that is also reducing. If it is going more, means our prices of the our groceries, everything will increase. So retail inflation rate is decreasing, means that is a good sign. 28th question. Which region in India experienced the highest rainfall deficit during the monsoon season of 2024? Northwestern region, northeastern region, southern region, central region. Correct answer is northwestern region. Northwestern region experienced the highest rainfall deficit during the monsoon season of 2024. The northwestern region of India experienced a rainfall deficit of 33% during the monsoon season of 2024. Then 29th question. What phenomenon has been identified as a major cause of increased floods during the Indian monsoon season? Cyclones, atmospheric rivers, earthquakes, tsunamis. The correct answer is atmospheric rivers. Atmospheric rivers, also known as flying rivers, have been identified as a major cause of increased floods during the Indian monsoon season. Next question. What was the primary cause of the landslide in Wayanad, Kerala in July 2024? Earthquake, heavy rainfall, volcanic eruption, deforestation. So correct answer is heavy rainfall. The landslide in Wayanad were primarily caused, that is believed by heavy rainfall within a short period of time, which led to the collapse of hillsides. So that is about the current affairs question also. So here our question ends here. So if you have any doubt, means you can comment below and I will try to clarify. So please share with your friends and also don't forget to like and subscribe this video. So thank you.